Hi gang, Dr. T here with our next top topic. Today's video is all about rodenticide toxicity. So this is when your dog or cat eats some rat bait. I'm going to pause for a second here and say if your dog or cat has eaten rat bait, stop watching right now and call your vet right now. You can come back later and learn. Now, I don't wish to be mean to dogs, but this problem is much less commonly encountered in cats as they are more, let's say, fussy about what they eat in most cases. We get a lot of questions in my line of work about cats who may have eaten a poison rat or a mouse. The truth is this secondhand toxicity is not commonly seen, and there are many studies to support this, but there is the odd exception when a cat may encounter a rat that has just eaten bait and has a stomach full that they may then ingest directly. People are often not too worried about rat bait because my animal seems fine, so they don't call in. But the difficulty with rat bait is that unless they've eaten very, very large quantities, where it can sometimes cause seizures, the signs of toxicity are not often apparent for several days, usually about 5 to 7 days in fact. And by the time they start showing symptoms, it is much more difficult to actually help them. Rat bait works by eliminating the body's supply of vitamin K. Vitamin K is produced by the liver and is used in making clotting factors, which are a major part of the body's clotting cascade. The body has a certain amount of clotting factors already, and these are used in many different places in the body at all times. So there are tiny little vascular events happening all over your body all of the time that require blood clotting. The reason that signs are often delayed is that it takes time for the body to use up the clotting factors that it already has, and after that, these little microvascular events become more problematic. Signs of blood clotting issues can include general lethargy, up to difficulty breathing from bleeding into or around the lungs. They can have pale gums, a swollen abdomen, blood in the urine, vomit, or black tarry stools. Less common signs can include lameness from bleeding into the joints, seizures from bleeding into the brain, blood in the front of the eye, or even sometimes blindness from bleeding into the back of the eye, amongst other things. As you can see, the symptoms are very varied, which can also be associated with many other conditions. So it's very important to seek veterinary advice if you see anything out of the ordinary with your pet at any time. For treatment, there's a two-pronged approach in most cases. Basically, we go for decontamination and prevention of bleeding. If you get your pet to us within a few hours of exposure, we can usually make them vomit, although this is often more challenging in cats. Or if there's been a very large quantity ingested, sometimes an anesthetic and gastric lavage or an enema can be indicated, which is pumping the stomach. I love my job. We often also after this will give activated charcoal by mouth. This is designed to bind the toxin within the gut so the body can't absorb it or will absorb less of it, and it's then excreted. This can sometimes cause your pet to have black stools for a few days, and in some dogs it can cause electrolyte imbalances, although this is rarely seen. Once we've completed the decontamination step, the next step sort of depends on how recent the exposure is, how much your pet has eaten, and other relevant history. In some cases, we can just recommend a blood test to check the clotting times in 48 hours. And this can be done at some vets, or other vets will need to send the test away to an external lab. If the clotting times are normal at this stage, often close monitoring for a few more days is all that is required. If the clotting times are abnormal, this is when we may start the supplementation of vitamin K by tablets, if your pet has not already been placed on it. Depending on the type of rat bait that was ingested, the tablets are usually required for between 2 and 4 weeks, and often a clotting time test is required at the end. It is important to note vitamin K tablets actually affect the clotting time test itself, so we need them to have at least 48 hours off of the tablets before we're able to accurately measure clotting times. During this period, your pet will need strict rest due to the fact if they are running about and causing bruising by knocking into things, or just increasing those microvascular clotting events that we mentioned before, and they're at higher risk of severe bleeding issues, which can be a big complication. So let's say the worst happens. Your dog got into some rat bait a few days ago and you didn't know about it. They'd usually start showing signs of being a bit out of sorts around day 3 or 4, and they're usually very unwell by day 5 to 7, although it does vary animal to animal, and depending on how much bait they ate and of what type. Some dogs can have such severe bleeding issues that they can need a blood transfusion to replace their blood volume and their red blood cells. In some cases, in these symptomatic dogs, we can do plasma transfusions, and that's all that's required without a red cell replacement, as the plasma contains all the clotting factors that are required. The vitamin K therapy would then be started immediately, which allows the liver to start producing its own clotting factors, and treatment then proceeds as normal. There are some risks with any transfusion, just like there are in human medicine. The main ones are something called hemolytic reactions, which is where the red blood cells are actually broken down. And also we can see anaphylactic reactions, so sudden drops in blood pressure, collapse, swelling, airway issues like you can see in people. Now these can sometimes be fatal, but there are more other subtle and more minor reactions that can also occur. The benefits will usually vastly outweigh the risks, which are low in most circumstances, but your vet will talk to you about that more directly around the time of transfusion if it's required. For those who are interested, dogs have two main blood types that we know of, although research is very much ongoing in this area. We have a DEA 1.1 positive and DEA 1.1 negative. DEA stands for dog erythrocyte antigen, and erythrocyte is a technical term for your little red blood cells. And there you go, you learned something. Dogs that are negative make the best blood donors, as they can donate to all dogs, much like O negative donors in people, as long as they haven't had a previous transfusion, that is. And positive dogs can only donate to positive dogs. Animals that have had a transfusion before are at higher risk of transfusion reactions, and cats, as usual, are an entirely different kettle of fish. They seem to have multiple different blood types and are potentially a little more prone to transfusion reactions. It's also more difficult to find feline donors. And as those of you who are familiar with cats will appreciate, very few cats will lie there perfectly still while we take a feline-sized pint of blood, or not a pint in a cat's case. And while most dogs require sedation or anesthesia for the procedure of donating, they at least have much bigger veins to draw from. A cat's blood volume, as you'll appreciate, would also be much smaller than a dog, which brings its own complications. Some clinics will have access to a dog blood bank or donor program, and others don't. Cat blood banks, at least here in Australia, are much less common, but it very much depends on the practice and facilities available. Blood banking itself is strictly regulated here in Australia, and donation and storage can be quite technical and time consuming. It is worth noting there are a couple of non-anticoagulant rat baits available in some regions that don't cause blood clotting problems and can cause neurological symptoms like seizures and tremors, or even mineralization of the tissues within the body with various symptoms. Again, sometimes these patients can be asymptomatic for days before symptoms occur. So the take-home message here is, if your pet has ingested rodenticide of any kind, do not hesitate to call us, even if your animal is fine. Your vet will be able to advise you on what the next best steps are for you, and often the sooner we can get to them, the better the chance we have of saving them. So I hope you enjoyed today's topic and learned a little something. Leave your questions in the comments. Keep your fur baby safe and well. Hopefully we won't need to see you in clinic, and I'll see you next time.